and that's Folau Talbot. He's a proud Aboriginal young man from the Gamilaroi and Kamilaroi nations. He's currently managing the Workforce Development ARC project that aims to develop evidence-based retention strategies for Indigenous frontline health and disability workforces. And this is what Folau's going to be talking about today. Oh, there you are. Yep, go for it.
Good morning, everyone. I'll just share my screen. Yep, can you see that?
Yep, all good. And we can hear you.
So good morning. My name is Folau Talbot. As Tom mentioned, I'm a proud Gamilaroi man from the Gamilaroi Nation up in northern New South Wales. I'd like to acknowledge and pay my respect to the people on whose land we present today. I'd also like to pay my respects to elders past, present and emerging. And I'd also like to extend that acknowledgement to all Aboriginal and non-Aboriginal people here presenting today. So as Tom mentioned, I am the manager of an ARC funded project that's New South Wales statewide. And it's to, the project is called Retention of the Aboriginal Health, Ageing and Disability Workforce Project. I just want to talk about this painting and acknowledge an artist, Anita Martin. And the inspiration of the artwork comes from many years as an Aboriginal woman working in rural and remote communities, promoting health and well-being. The artwork depicts the visual narrative of many rural and remote Aboriginal families' vision of creating a positive and brighter future for family members with disabilities by building on community strength and resilience. So the artwork is actually called Resilience. This project is led by Indigenous people and implements Indigenous methodology. This project aims to develop evidence-based retention strategies for Aboriginal frontline health, ageing and disability workforces. Aboriginal people in these roles play a significant part in improving access to culturally safe and effective services and supports for Indigenous Australians. Little is known about the push and pull factors that influences non-university qualified frontline Indigenous health, ageing and disability workforces. This study will discover the push and pull factors that influence Aboriginal frontline workers to stay in their crucial roles. We will translate our findings into culturally appropriate workforce retention strategies. So we have project administration and governance, project operations committee, and the members such as chief investors, institution partners, interested research assistants of the project.
Paul,
yeah.
Folau, your video, you're breaking up a little bit. So can you turn your camera off and just see if that helps out on bandwidth? We'll still see the screen, but we won't see you. Yep, that's good.
Is that better?
Yeah, well.
Yep. Sorry.
See how that goes.
Okay. So project operations committees are the members such as chief investors, institution partners, interested research assistants of the project. Operational committee is to strategically think and implement the project to achieve the overall project objectives and aims. They communicate to the project team and the strategic advisory group. The project team consists of chief investigators and partner investors, alongside the project team, which are the operational and administration decision-making of overall project objectives. Project operations. The strategic advisory consists of members from peak bodies such as Allied Health Australia, NDS, National Disability Service, the Poche Centre for Indigenous Health, and the University of Sydney. Alongside the project team, which are the operational, interested in the research who have partnered such as Indigenous Allied Health Australia, National Disability Service, and the Aboriginal Health and Medical Research Council, so AH and MRC, as well as other key stakeholders as the University of Sydney, academic and research assistants. The purpose is to provide strategic advice for the project, directions, as well as cultural advice on all aspects of the research. This group is an important role to the Project Operations Committee. The project team communicates to the project staff and the project methodology team. The methodology team are made of interested research assistants and chief investigators. The project team also consists of same or similar interested methodology team members, but in direction of working together in order to connect with communities. Yeah. So with this project, there are two phases. There's a survey phase and an interview phase. So the survey phase is what I really want to talk about today. So we developed a survey for pretty much the whole of New South Wales. We wanted to get their thoughts. In this strategy, we needed to capture the diversity of ideas to invoke discussion amongst people. So we used a software that uses word clouds to gather each individual's thinking around the push and pull factors that influences Aboriginal employees to leave or stay in their roles. This software allowed participants to participate in an activity creating a word cloud, which you see on the screen, of their experience working in these sectors. The participants were asked to contribute words which they felt described either push or pull factors that they had experienced in the places where they had worked. Using the latest word cloud software, Menti.com, the CIA and project manager were able to go live to get live results whilst attending the staff meetings with advisory group members. This approach was very successful and gave the project team a good insight on what push and pull factors affect the workforce within these sectors for the survey question. There were over 90 Aboriginal workers and leaders and their employees who helped the project team co-design the survey and interview questions for this project. All the word clouds were analysed collectively to ascertain the main themes. After lengthy discussion and long thinking process, two of the project team members who had done the analysis from the word clouds, it was clear to say that all input from the word clouds related to these 5 key themes: support, racism, culture, training, and job satisfaction and conditions. With these 5 key themes, more lengthy, thoughtful discussions between the project team and the advisory group and governance partners, we all agreed on the key themes that stood out. I was very fortunate to meet with some of the Poche scholarship students to do a workshop around these themes. The aim of this workshop was to go into more depth about the themes and to come up with some more ideas and questions around these themes. The students separated into groups of 3 to achieve the following: discuss in depth the word cloud, the words included in the word cloud, and listing the key issues arising from that word cloud. Brainstorm each theme, create questions to address the issues that we raised. the students were asked to write a sentence about the prescribed thing in a way that they would understand using cultural safe language that they would understand.